consideration. Okay, and this consideration is what is known as the natural medical history of ventricular septal defect. So sorry, I'm just trying to plug my laptop. So what this actually means is this: if a patient has ventricular septal defect, what is their medical history likely to be like? What are the things they will likely complain about and everything? Okay, so natural history of ventricular septal defect, of course, is now you are trying to classify ventricular septal defect into the different types. So of course, you can talk about the small ones, the medium ones, the large ones. So, but what the patients will complain about depend on the size of the ventricular septal defect, the location, where is it located, and whether it is causing some significant hemodynamic changes. Do you understand? That's what will actually determine the complaints that the patient will be having. So first of all, trying to understand what is a ventricular septal defect, you should know that it's an abdominal opening between the ventricles. Those are the lower parts of the heart. So it's the most common heart defect, and it occurs in about 30% of cases of once you hear congenital heart defect. You should just know that most of the times it's a ventricular septal defect, right? So sorry, I have to cover myself because I just turned on the AC because my laptop is getting hot. Okay, so it's one of the most common congenital heart defects you have out here. So for the small ventricular septal defect, it's often asymptomatic. Maybe they discover it incidentally. There's a high rate of spontaneous closure. So some of them, if they are so small, they can even close on their own. Closure typically occurs within the first few years of life. Okay, rarely cause any prolonged or long-term problems. So for the moderate ventricular septal defect, what patients they are likely to complain about include things like, you will pick up mild heart murmurs, fatigue or poor weight gain. They can be losing weight so much. So some of them close spontaneously, while others might actually require some 1 or 2 medical interventions. Okay, usually not really much medical intervention. Therefore, the large ventricular septal defect, they cause significant left to right shunting. They lead to volume overload. So symptoms include all those heart failure, recurrent respiratory infections, poor growth. So if untreated, they can lead to what? Eisenmenger syndrome. Okay, so that's it. So surgical repair is often needed in infancy and early childhood. Okay, so that's what we got. So factors influencing the outcome is basically muscular ventricular septal defects are highly spontaneous. Closure rate. So perimembranous ventricular septal defects are less likely to close on their own. So the size matters too. The pressure matters too. Okay, and if there's any other associated heart defect, can also worsen the outcomes. Okay, so that's it for the ventricular septal defect. The natural history of the different types. Okay, how they are likely to be on the outcome.